Hi everyone. I hope you all had a good break and that those of you who are UVA faculty, staff, and students are ready to start this new semester. I'd like to begin by thanking you again for your efforts last semester. Without your dedication, commitment, and discipline, we would not have been able to complete the semester safely and successfully. You were able to accomplish something that many doubted was possible, and it was your concern not just for yourselves, but for others that made all the difference. My main message today is that we're going to need the same resolve and compassion this semester as well. As you know, last week we announced that we will welcome undergraduate students back as previously scheduled. Like last semester, not all classes will be held in person, but all undergraduate courses, both in person and online, will start on February 1. We're also sticking with our existing plans for the start of graduate and professional programs, which have a range of start dates for the semester. If you're a graduate or professional student with questions, please check with your individual school or program. Now, we did not make this decision lightly. As you may know, the number of COVID cases is at an all-time high, both nationally and locally. But after many conversations with medical and public health experts, we've decided to bring back students for several reasons. First, we learned a great deal this fall and are in a much stronger position to respond to the virus. We can now perform thousands of tests per day, and we will be requiring every student to get tested once a week. We are also making regular testing available to faculty and staff. We also have more experienced support teams and more isolation and quarantine space, and as a community, we have more experience following and enforcing health and safety protocols. As was true in the fall, we also know that thousands of students will be in the area this spring, whether classes are in person or online. Many of them already are. By welcoming those students to grounds, we will have a better sense of what's happening and will be able to do more to keep our students and members of the community safe. Leaders in the health system are also confident about our hospital capacity. UVA Health has about 740 hospital beds, and while the health system is busy right now, that activity is driven primarily by non-COVID patients, many of whom are undergoing elective procedures. We have opened a second COVID unit in our new bed tower and can flex to create more beds if the number of cases goes up. We will keep monitoring the situation closely and adjust if we have to. We also learned a lot last semester about how the virus spreads and the relative risks of different environments. We didn't see any evidence of transmission within classrooms or from UVA students to faculty, staff, and members of the community this past fall. And we have every reason to believe that will continue to be the case as long as we keep following health and safety guidelines. That last part is going to be more important than ever. With more COVID cases in and around Charlottesville, and with news of more contagious variants being detected across the country, we are going to have to be even more vigilant than we were last semester. That's why we're taking additional steps to prevent the spread of the virus, from encouraging students to quarantine before returning to grounds, to requiring all students to submit a negative COVID test before returning, to testing all students within 7 days of arrival back in Charlottesville. We're also limiting the size of gatherings to no more than 6 people starting January 19th and continuing through at least the first 2 weeks of the semester. Now, I realize that this limit asks more of all of us, especially our students, but we want to make sure we can do everything we can to get off to a strong start and avoid a surge in cases at the outset of the semester. We've heard from many of you, especially faculty, staff, and members of the community, about when you'll be able to get the vaccine. The Virginia Department of Health is in charge of distributing the vaccine, and UVA Health is partnering with our local health district to accelerate distribution. We're giving out as many doses as we get to the people VDH and the local health district tell us are eligible, but it's going to take time to vaccinate everyone. For a number of reasons, as Dean Groves will explain in a moment, it remains incredibly important for everyone to keep following the health and safety measures, especially mask wearing and social distancing in public, even if you've had COVID or have already received the vaccine. This semester won't be easy. As I mentioned, if anything, it's going to take even more patience, more vigilance, and more creativity from all of us, especially until the weather gets warmer. The difference between success and failure, as with last semester, really will come down to the many small personal decisions each of us makes every day. We will need help and resolve from all of you to make this semester work. We all know by now that COVID is a virus that will take advantage of every lapse and misstep, which means that our health and safety guidelines and university testing strategy have never been more important. Conditions are more challenging than they were in the fall, and we will be prepared to change plans if we have to. But we've been through this before. We know what it takes, and I'm confident that together we can make it through this semester just like we did the last one. I look forward to seeing all of you soon, even if it's virtually. And now I'll turn it over to our Dean of Students, Alan Groves, to talk a little bit more about what this semester will look like for students. Thank you.
Thanks, Jim. I want to start by saying thank you to our students. Last fall, we asked you to return to grounds only if you were prepared to make personal sacrifices and help us protect the entire community from COVID, including those more vulnerable than yourselves. This meant conducting events virtually, limiting the size of gatherings, and complying with masking and social distancing requirements. I want to specifically thank our student members of resident staff who work to keep everyone safe in our residence halls, and also our fraternities and sororities who came together early on and agreed to refrain from hosting social gatherings, as well as everyone who stepped up in a public health crisis to allow the university to maintain an in-person semester. Now, there certainly were some instances where compliance fell short and required that students and student organizations be held accountable through our student-run UJC, but those tended to be the exception, not the rule. When cases spiked in September and gathering limits had to be temporarily reduced to 5, students responded to the challenge and case counts began to decline. So again, thank you. Now, as President Ryan said, we're faced with a situation that is not unlike September. Case counts are spiking regionally and nationally. Last Friday, the New York Times reported that the CDC is warning, and I'm quoting here, that a far more contagious variant of the coronavirus, first identified in Britain, could become the dominant source of infection in the United States by March, and would likely lead to a wrenching surge in cases and deaths that would further burden overwhelmed hospitals, close quote. Now, this is what we face in the coming weeks and months. For this reason, we've lowered the gathering limit to 6 people until at least February 14, when it will be reassessed. This number was chosen in consultation with medical experts as a good limit to allow some socialization while helping reduce the threat of viral spread. It also allows a suite of students in a residence to gather without leaving anyone out. Our fraternities and sororities have also agreed to comply to this limit in their upcoming recruitment activities, which is critical. Now, we have a system in place to review requests for exceptions to the gathering limits, although any exception must stay within the restrictions set by the Commonwealth, the city, and the county. Last fall, we received 40 such requests from student groups and schools, including graduate and professional schools, and approved 32. Exception requests must clearly set out the nature of the planned event and the measures being employed to help ensure safety and avoid virus transmission. Such requests may be forwarded to our office via odos@virginia.edu. We will also continue to look for other opportunities for you to safely engage in student life within the restrictions necessitated by the virus. Now, that said, I need to make clear that we will step up compliance enforcement this semester, given what we're seeing in virus trends and rising case counts. We have to protect our community and avoid overwhelming our medical system. Students should be well versed by now in what is required, including the necessity to gather in groups of 6 or less, wear masks at all times, and maintain a 6-foot minimum distance. Given the increasing risk, we will move even more quickly to immediately address violations and, in the most severe cases, suspend those who will not comply. It won't take many violations of scale to quickly unravel the in-person aspects of the spring semester, so each person's decision to fully comply really does matter. I also want to speak about the perception among some that once you have had COVID, restrictions should no longer apply to you. As university leadership explained in an email last Friday, the science around whether those who have had COVID can contract the virus again and spread it to others is inconclusive. People who contract COVID may shed the virus for a period of time that extends beyond the alleviation of symptoms or a positive test. Of course, our fellow community members also have no way of knowing which people previously tested positive and which are putting themselves and others at risk by ignoring health and safety standards. Universal adherence to COVID prevention restrictions will avoid anxiety within our shared community and prevent potential conflicts. Most importantly, following these standards is part of the commitment people who are on grounds made to the university and to each other. Lastly, with respect to the COVID vaccine, except for students training in a healthcare field and working with patients, the general student population is not yet eligible to receive the vaccine. If you have not received an email invitation directed to you, you're not eligible for a vaccine right now. So we ask that you please do not try to sign up for one yet. Our local health district is working to vaccinate what are called Category 1A, healthcare personnel and residents of long-term care facilities, with the assistance of the UVA Medical Center. The health district is next moving on to Category 1B, focusing on those age 75 and over. We do not yet know when most students will be vaccinated, as you are not in any of the groupings announced so far. The governor has said he hopes all residents of the Commonwealth will be vaccinated by the early summer. As soon as we know more, we will let you know. By choosing to return to grounds this spring, you're agreeing to abide by the restrictions imposed by the university and to stay aware of any changes to those restrictions that may be necessitated by changing viral trends. This means you need to read the weekly COVID email updates, which we're working to make easier to navigate and briefer so you can get the information most pertinent to you. Our students did an admirable job in working to keep everyone safe last fall, and we need an even greater level of commitment this spring as we enter what may be the most potentially dangerous phase of the virus in terms of rising case counts and ease of viral spread. I know we are capable of doing this, and I wish you the very best as we begin the spring semester in Charlottesville.